Hörer, wo immer Sie auch zu finden sind.
Oh, okay. This is an English show. We're in America, madam. GiGi, what did you just say? And everything okay there?
Yes. Welcome, everybody, wherever you are. You have now entered the cosmic radio receptors of KCIW LP 100.7 FM in Brookings, Oregon. I'm Dr. GiGi, and you are tuned into this week's edition of Doc and Jacques with bumper music.
Yeah, the bumper music was cool, though
Yeah.
you can't hear it.
No, not yet. KCIW LP community radio located right here on this lovely coastal paradise. My co-host is Herr Jacques Wolf. Wie geht es so, Wolf?
Hallo, wie geht es dir? Comment ça va?
Merci
Dr.
bien,
GiGi?
sehr gut, danke, Monsieur Wolfien.
Okay, slap back out of it. Back in English. Here we go. Hi, neutral. Hi, folks. Thanks for tuning into this show, which is a variety show of sorts, where every Wednesday between 4 and 5, you will hear a full hour of live radio under the guiding hands of our engineer, Tom Bozak. Thank you, Tom. And
Thank you.
Hey, I guess we didn't hear it, but the bumper music's there. So for all you listeners, you could get to me, reach out to me and say, hey, we like the bumper music.
Awesome or something.
Or not, but
Yes.
no, it was good music. We got a big fight over it.
All right, well, either way, we're starting right now. We will start each week with the bumper music and then with a medley of fascinating stats and facts and some medical info that can affect our health.
And after the doctor dispenses her medical wisdom, we will introduce this week's candid guest for a colorful conversation, and she's quite a colorful conservationist. No, conversationist, sorry. She's in conservation, too.
We will save the last segment of our weekly show for some good humor. We need some humor at the end.
Oh, I got the good jokes today.
Clean
Are you ready,
jokes.
Janice? Okay, get ready, Janice.
Contemplative quotes. And all of this is starting right now on Doc and Jacques.
And Dave Howland, who listens for our jokes. Okay, that's my cue to kick off this week's topic of MDGG, or medical dialogue, according to this German-born, patent-holding research scientist, practicing family medical physician trained in England and at the Bronx Hospital, and on. Dr. GiGi,
Yes.
what have you got for us, Doc?
Thank you. Well, today we will talk about digestion.
Oh, the stomach issues.
Yes.
Oh, stomach and digestion.
Now, we have
Ooh,
a
this is
ton
nice.
of this really cool stuff.
I like this stuff.
So digestion actually is a breakdown of food into smaller and smaller and smaller and smaller components until they can be taken up into the body.
What do you call stolen digestion medication, doctor?
What?
Klepto-Bismol. Okay, that's one down.
Okay, great joke. So now you should say, wait, I think we're already in the body because we're eating food. Not so.
Okay, wait a minute. You say it's outside the body? Our
Yes.
digestive system is inside of our body, doctor.
Yeah, so that's what we think, but technically it is outside of our body till it is taken up into our bloodstream, because our GI, or gastrointestinal tract, is the tube that starts with our mouth and ends at the anus, and whatever is in there is basically still on the outside, or considered outside of the body. It consists out of our mouth, esophagus, stomach, small intestine, and large intestine. And digestion takes place basically in all of these parts. Now, we're also using little helpers. We're using enzymes, which
I'm an enzyme.
okay, these are biocatalysts, bacteria,
I'm bacteria.
and mechanical processes. Chewing is a
Oh,
mechanical.
wait. Oh, is that wait a minute.
Masticate.
Mastication. I won't say the other word. But
No.
mastication is chewing, right?
Yes, darn tootin', right.
Tom, excuse me.
Are you chewing?
I'm chewing.
Okay, other organs help us with the digestion, though, and that is mainly the salivary glands, the spit glands,
Oh, good.
the pancreas, liver, and the gallbladder.
We produce quite a bit of spit, don't we?
Yeah, like 2.5 pounds
What?
a day.
A year? Yeah, a day?
day.
We're producing that much, you know what?
Yeah.
Yuck.
So the digestion starts in the mouth with chewing, as I said, mastication, and addition from enzymes that can actually already break down starches to sugars, and we also break down some proteins. This is a fun fact. If we're eating starches like potatoes and we're chewing long enough, they taste sweet because starches are sugars in a row and some side chains. That's what starches are.
Doctor, do you know what baby potatoes are called?
What?
Tater tots. Okay, Tom laughed. And I think
It takes about 7 seconds for food to travel from our mouth to our stomach.
But 7 seconds, come on. I mean, I could eat a piece of meat, which I don't really eat that much meat, but if I chew, it's a lot longer than 7. Oh, you're saying once I swallow
The
it?
swallowing, mouth not sitting there in the mouth, but then as soon as we send it off, it takes about 7 seconds. Now, and only a few things are absorbed into the bloodstream, remember, going into our body at the level of the stomach, in the stomach, which are, interestingly enough, things that usually cause stomach irritation, such as alcohol
causes stomach irritation.
aspirin, and other NSAIDs, non-steroidal anti-inflammatory drugs.
NSAIDs are, I know that, non-steroidal anti-inflammatory diverticulitis.
Drugs, right. Now, this is another fun fact. The GI system, gastrointestinal system, plays host to more than 500 species of bacteria.
Okay,
Not 500 bacteria, 500
trillion. Oh, you're saying
500 species, 500 different kinds of
And
bacteria.
they all kind of have a big party down there?
They all have a big party. They all get along.
Wow.
And so when people say just give an antibiotic, well, one antibiotic doesn't work for all. So you really have to make it species correct. So that's kind of cool. The other cool thing is we're not born with any bacteria in our gut.
Stop.
Yeah, true.
Stop. When you're born, your mom just ate some pasta. You're eating pasta with bacteria in it, right? If you're in the womb.
Not really, because, well, it depends on how you do it. No, the mother's blood that the person in the womb, the baby in the womb gets is not full of bacteria.
Well,
we don't have any in the intestine. Remember how the intestine is the outside, and in the womb there is no outside yet? They don't eat, the babies in the womb don't eat food.
So as soon as they're born, you start feeding them round up dollar bills, old ones, with milk and feed it to them. They get the bacteria that way, right? No, don't do that, folks.
Don't do that, please.
Hey, what do you call a fake noodle?
A fake noodle?
Impasta.
Okay.
Okay, I'm hitting on all cylinders.
This is a cute one. A woman's small intestine is longer than a man's small intestine.
I have,
Okay. The whole digestive system is about 30 feet long.
Wait, I've heard it's longer than that. You know, some animals, like a big bull elephant or hippopotamus or these big animals, bulls and stuff.
Yeah.
You know, they are vegetarians.
Yeah.
All right, they're vegetarians. That's all. They don't eat meat.
That's interesting.
Okay. Well, their intestines are extremely long, whereas, you know, a tiger, a lion, a hyena, they are meat eaters.
Yeah.
Their intestines are extremely short.
Whoa.
Guess where we are as human beings? Are we closer to the short or the long?
We're in the middle.
We are the longest of all species on Earth. We have the longest per comparison size to any species, any animal on Earth. That makes a good sense.
So what does that mean?
Be vegetarian, because we're meant to be vegetarians.
That's a good argument.
Only people that raise beef.
Noted. Thank you.
Jump in my keys.
Stomach acid, or HCl, hydrochloric acid,
Same one that runs my battery.
is able to dissolve metal.
Whoa.
Yeah.
Wow.
About 10% of all people are intolerant to gluten, which is a protein in wheat.
Gluten's
It's called
not a good thing.
gluten intolerance or celiac sprue.
So a lot of human beings have gluten intolerance.
Yeah.
Okay.
10%.
Wow. Yeah, that's pretty big.
About 65% of older people develop, or not babies anymore, develop lactose intolerance.
Babies, lactose, okay.
Yeah, so that is something that develops in adulthood.
Okay.
To be able to drink mother's milk is only valid for, and then later we don't need it anymore.
Okay, so speaking of that, that's cow's milk, and I've heard like giraffe's milk is more closely related to human milk than cow milk. It's kind of an alien thing, but we are sold on.
Well, we don't have too many giraffes here. Maybe that's part of the reason.
Hey, I'm not a vegetarian, but I eat animals that are. Okay, let's wipe that one off. Okay, I'm getting my jokes fast.
The gut is regulated by its own little mini brain, meaning we have some nerve cells that use the same neurotransmitter, same little chemicals that go from one nerve cell to another. And they work together. if you think about if you're getting totally stressed, you might have diarrhea. So that is the GI tract saying, don't waste your time getting all the water back. Get rid of the feces and run away from the tiger or such.
Oh, I see. It's more important.
Fight or flight is more important, right?
That's an ancient thing.
By the way, stress eating is a learned behavior.
One of my favorite quotes is, let me take a nibble in peace and quiet versus an entire feast under stress.
Yep, that's a good one.
Okay.
Don't
what
forget
else
that stress eating is a learned behavior. Very important.
Okay.
So I want to mention just a few little pathologies, sicknesses that can happen with, there's, the normal gastritis and have diarrhea and whatnot. So everybody has that. The more important ones are the celiac disease that I already mentioned, the gluten intolerance, which is actually an autoimmune disorder, believe it or not. And so when they go in, the gold standard to detecting that is actually a colonoscopy or EGD, whatever, and taking a section, a biopsy, where they see that the mucosa, the inner wall, is actually atrophied. So
atrophied meaning dying.
Atrophied is not being as strong anymore. So there's spaces missing in there. So it's not three-dimensional, it's more flat, basically.
Okay.
There's diverticulitis. And diverticulosis.
Diverticulous? I had that in Missouri.
Those are diverticuli are little pouches. They kind of pouch out of the small or the large intestine that often is caused by being too constipated. And you push and you push and you push and it just doesn't go through. And so it kind of plops out of the wall.
Oh, great.
Diverticulitis is when it's inflamed.
Okay.
Very painful. Diverticulosis is asymptomatic, basically. So most people have diverticulosis to one degree or another. Now, there's three more things I want to talk about. There's IBS, irritable bowel syndrome, where we don't really know the cause. It is the most common functional gastrointestinal disorder. Nobody really knows why and what and who, but they know you can have diarrhea with it, or constipation, or both, and it's probably has to do with the nerves, the little mini brain. And there's Crohn's disease and ulcerative colitis. They're IBDs, inflammatory bowel diseases, and they're both autoimmune, thought to being autoimmune. They both have ulcerations in the small or the large, colon, and they're very painful. And so there's not super much that can be done. Sometimes you have to do surgery to take the piece of colon out that is affected.
Yikes.
You have to be on medication. You cannot eat certain things. So those are very painful, and they really should be seen by a specialist because they're something rather.
Wow. Okay. It is, by the way, February 7th, Wednesday, 2024.
And it's sunny.
And it's sunny outside, yeah. Before I get to our guest, I want to say that tomorrow night, Ray Gary, our associate, everything guy here at the station, is having his 40th birthday party at Chetco Brewery. And everybody's invited to come between 5 and 7, but we usually stay till 8. They're going to have open mic night. And if you know Ray Gary, he's a cool guy. He's an upright, outstanding man. Has long hair, looks like a hippie, but he's totally cool. And we all love Gary. So if you're not doing anything tomorrow night, the 8th of February, then come on down to Chetco Brewery and have fun with Ray. All right, so do you have a ladies' choice? Ladies first? You read a little bit of that. May I have that? I was looking all over for it. It said, hey, folks, today's live broadcast of Doc and Jacques' radio show here at the KCIW studios is a special type of show that GiGi and I frequently broadcast, and one that we affectionately call Ladies First. Yeah. This is when we are honored to have a candid, interesting conversation with a talented, inspired woman that excels at what they do best. And today's guest epitomizes this criterion. She comes to Doc and Jacques well vetted and recommended by many of our friends and informed listeners. we literally stumbled upon her. You did, looking for a lost pig in Crescent City one day. And this lady came out and said, yeah, I saw a pig cross the road over there. Months later, we run into her a couple of weeks ago in Crescent City. And she goes, oh, yeah, you were the ones looking for the pig. And we got to talking, and what do you know how the universe works? Isn't it amazing what we find out, what people around us? Because we found out that she is a mover and shaker in an industry that is close to my heart and invariably many of yours, whether you like it or not. Since getting to know her, I found her to be a sharp, contemplative spirit who listens more than she speaks, and someone who perfectly fits the title of her chosen profession. You know, at my age, I have 65 now.
Whoa.
Yeah, 20 years younger than... No. And Ray. I have fortunately been a conscript of this woman's passion, for I have lost some of the greatest treasures that I have ever known. And those treasures, of course, are my human friends and loved ones that have passed into the great big blue of eternity. Whether or not you have experienced tending to the final episodes of a loved one's life by slowly dying, or, as in my case, tragically, one entity has always been there for me, and millions upon millions of others have been well served by it. End-of-life care and the subsequent grief and grieving are in themselves somber subjects, except inevitably each and every one of us will face others and our own demise. Yep. The entity that I referred to is, of course, hospice. Well, there you have it. We're going to find out what hospice is, where it's been, where it's going, uniquely to our community here in Brookings, Crescent City, and beyond. For joining us in the radio station is none other but the CEO of Coastal Hospice, serving Dougherty County, Curry County, and beyond. I got a big welcome to Jamie Daugherty. Welcome.
Welcome.
Thank you. Thank you. I'm glad to be here.
Right. You were on the show, K-Funk show, with me an hour and a half ago. So she's our firstie ever to
A double.
Yeah, she was
whammy.
on my show at K-Funk, and now she's here in the KCIW studio. Once again, welcome. What do you got for her, Doc?
Well, Jamie, where did you grow up?
I grew up in the San Francisco East Bay, so Alameda County area.
All right. Cool.
No. And how long have you lived here? And do you still like it?
Yes, I've lived here 5 years and going on 6, and I came over from Medford, and I love it.
How long were you in Medford?
15 years.
Oh, wow. Mm-hmm. Okay. Now, what is your position? We already said it, but give us a little background of your position.
CEO,
yeah,
right?
CEO of
Coastal Hospice.
Yep, Coastal Hospice, Coastal Home Health and Hospice. And I was recruited from Medford for the position. And I love the work and I love the area, so I came over.
So what did you do in Medford?
I'm an RN, so I worked in home health over there.
Okay.
You were involved in hospice over there, so you got your feet wet, per your ruling, right? Okay. What is the mission statement for Coastal Hospice?
Yeah, we provide quality, compassionate, holistic care for individuals and their families at end of life, trying to make sure that they have, that we're honoring their choices. So we really want to make sure that the care that we provide is about meeting their needs and not ours, and making sure that we are meeting their goals.
Okay, cool. Is it a nonprofit organization? Is it a 501c3?
We are a nonprofit, 501c3.
Right on. Just like the radio station, KCIW is a proud 501c3, not-for-profit thing. Go ahead. Ask a question, Doc.
All right. What's the history of hospice?
In the U.S.
Yes.
I asked part of it. Okay. She pointed at me very...
So I'm going to go back just a tiny bit. Historically, we as humans, we've always cared for our dying family at home until about the hospital institution as we know it now came about. Then people started dying in the hospital.
Yeah.
So 1967 in London is really when hospice as we know it today was born. It came to the United States in 1977. with the first hospice program in the United States. And in 1982, Medicare and Congress made it a benefit for Medicare, and that's when it really took off nationwide.
As Medicare
Paying for
program?
hospice, yes.
Oh, how about younger people on hospice?
Well, that's up to whatever their insurance is, but
see.
Medicare, it really sets the standard for care.
Yeah.
So whatever Medicare does, everybody follows.
Oh,
So it came over in a wave from England, like the Beatles, right?
Right.
There we go.
okay. All right. Now, tell us about, for people who are not super familiar with it, what services do you provide as hospice? I think you're also home health, right?
Right.
But we're wanting to know about the hospice part.
Yes. So we take care of people that have a terminal diagnosis in their home, wherever that is. So if they call a facility their home, then we would go there.
Yeah.
And we come to them. We bring nursing services, social workers. We have a spiritual care coordinator that can take care of your religious or non-religious needs. We have a bereavement coordinator. And we have a hospice aide to take care of personal care needs. And we also provide pharmacy, so all of the drugs and durable medical equipment.
Now, I had actually, I took part of hospice. I had a partner who died, and he was on hospice, and I'm a medical professional, right? But I have never actually personally been involved with hospice, and I have to say it's, the German I am, I don't need that, I don't need this. And it was just so helpful. It really was. Even, I have seen people die, and it's not foreign to me. But if it's your loved one, it is a different story. And it is really, it's amazing. I'm really kudos to any of the hospice people in the organization. It's a great help. Now, who regulates hospice?
Medicare sets the rules, and each state is tasked with enforcing those rules and making sure each agency is following them.
So I sometimes write for end-of-life care medications through home health, but I don't know of any rules that I have to actually follow. So how does that work?
You're a prescriber, so you don't necessarily have rules. You would have to follow the drug rules for the pharmacy, and in terms of being able to dispense those medications. But those are the only rules.
Okay.
Hey, I got a quick question. You touched on it at the earlier interview. What is hospice not? Help us dispel some of the myths.
Yeah, so we do not kill people. We do not euthanize people. That is something
that is amazing
that people think. We don't give them a shot to finish anything. We don't make them sleep through the rest of the end of their life. We don't do any of those kinds of things. They're not locked into it. It's if you don't die naturally, we don't make you die.
Right.
It's really very much, we just hold your hand through a process that you're already going to be going through. And so that's really what we do.
Wow. You work in both Oregon and California, our unique area here where we live right on the border. And so you're operating in Del Norte, you're operating in Curry County. Curry County, you're well established, more so. You're just, what's the history of Del Norte? You just recently moved into Del Norte?
We did. We moved. We became accredited in Del Norte in April of last year.
Wow, welcome.
Yep.
Yeah, so that was a big deal. It took a couple of years because we started right before COVID, and so that really put up a lot of barriers for us. And then, but we managed to get through it and get our accreditation.
What's the biggest difference between Oregon and California? Is it pretty seamless? You have a bigger operation here in Brookings?
We do have a bigger operation. I mean, there's more rules in California, but
no kidding.
Yes,
really?
but yeah, I mean, it's pretty much the same.
And how many people do you have all employees? Do you have volunteers? Tell us about how you work. How many people?
We have about 40 staff members, and they serve both counties, so nobody is specifically one county.
So they have to be certified for both.
They are licensed in both states,
yeah.
yes. And we also have 15 to 20 volunteers, and they are so important to what we do.
Yeah.
They really, really just enhance the quality of life in terms of having somebody that's just there for you. They listen. They can read books to them. They can do housework, pet care.
Do you train them? Do you train them?
We don't really. I mean, we train them in hospice philosophy, and we train them in what hospice means and what it means to be a volunteer. But we don't train them in skills as far as how to do. It's really, we want them to do what they like doing, and we want them to do what they're skilled at doing. And so if they want to do yard work, then we will hook them up with somebody. Maybe they're a veteran, and so we'll set them together with a veteran patient. And so we try to match them. But we don't teach skills. We teach about hospice and what it means and what it means to be end of life. But they use their own skills.
Are you always looking for volunteers?
Very much so, yes. We love volunteers, and we're always looking for them.
Okay, so at this point, grab your pens, because in a little while, we are going to be, you could take down her number. She's going to be giving her phone number and websites and all that kind of stuff.
Yeah.
So later on, have that ready to go so you could write down how to reach out to Jamie Daugherty here on KCIW.
Who qualifies for hospice?
So you have to have a terminal diagnosis where our hospice physician says that you are likely to die of that terminal diagnosis in the next 6 months.
So you have your own physician?
Yes, we have our own physician. And so that person, Medicare requires that person says that they have the terminal diagnosis.
Yeah.
So if you get a terminal diagnosis from your doctor, it doesn't necessarily mean that you're going to qualify for hospice. It has to be that 6-month window.
Right.
And then you would be able to get on service with us. That being said, your doctor doesn't have to send you to hospice. You can take yourself to hospice. You can start that conversation with us immediately at any time, and we are the ones that determine if you're ready or not. And then we'll let you know if we feel like there's a time frame when you may be ready, or if there's tests that need to be done to get you ready.
Wow.
Okay, to be in that service.
Mm-hmm.
So hospice care is meant only for end of life?
Correct.
So what is the difference between hospice and palliative care, which is end of life care?
Well, palliative care is not necessarily in the last 6 months, right? Mm-hmm. It's really any point in time where there is suffering from some kind of a disease or process, and you need relief, but there's no cure for it. Mm-hmm. So you're not seeking a cure, but they're still needing relief, but they're not going to pass away in 6 months. Right. So that's that kind of window where maybe there's a cancer and you're going to live for a couple more years, but there's no cure for it.
Okay. Is American hospice unique?
I don't really think that it is. Like I said, this was really born in London.
Yeah, but in London, in England, the hospice, you go to hospice to die. Mm-hmm. They don't come to you like we have in America. It's usually, I associate hospice with the hospice workers coming in, sitting beside the bed of the dying person.
So this is here in Louisiana. We actually had a hospice center where people could go if they couldn't be provided at home. There was a small little hospital type setting for people to actually go as well.
Yes, we do have those here in the United States.
Oh,
they are just not as common because most people do want to be at home with their family.
Yeah.
Wow.
And there's one in Eureka.
All right, cool. All right, amazingly, we are already at that halfway point. I told you, Jamie, like earlier, it goes by so fast.
Goes fast.
You're a well-spoken woman that is answering all our questions and many more to come. You are tuned in to KCIW LP, Curry Coast Community Radio, 100.7 FM in Brookings, Oregon. Thanks for tuning in to this live show here on Doc and Jacques. Every week we bring you a host of interesting people. And if you are an interesting person, whether you be an artist, musician, business owner, or someone like Jamie that makes an impact on our society, please let us know. And you could be sitting across from us in this very studio, this beautiful studio, by the way, at KCIW. The best route to reach out to me and GiGi is just go to my Facebook page, Jacques Kepner, that's K-E-P as in Paul, N-E-R, and friend me. Or look for us around town, like tomorrow night at Ray Gary's birthday party at the Chetco Brewery. Yeah, between 5 and it'll go till 8, but knowing Ray, it'll go on until 1 or 2 in the morning. You'll see us out there. Reach out to us and let's talk. Again, KCIW 100.7 FM. Back to questions. Am I asking or are you asking? Where are we, Doc? Let's find out our page. I love the shuffling of paperwork. Oh, yeah. Okay. So what you said something earlier today, Jamie, earlier the conversation about it's a human right. What kind of treatment can a patient expect?
So we really, our primary goal is to alleviate physical and psychosocial suffering, psychological suffering. And so that is going to be what we're going to do. We're going to make sure that there is pain relief, there is breathing relief, there is anxiety relief. I truly believe that hospice care is a human right, that it is not something that should only be given to those that can afford it, which is why we're a nonprofit.
Yeah.
And so we do take patients that are unable to pay because it's a right.
Right. Absolutely. On. And what do hospice patients, if you've seen so many people, you've been bedside with me, people have passed on. What do hospice patients want the most at their end of life? Is there any cumulative thing you could say?
Well, everyone's different, but it's really about alleviating that suffering. And it could be there's fear and fears too. So there's fear of pain, there's fear of what comes next. So that's that spiritual unknown. There's what is going to happen to my family after I'm gone. Right. So that's really what we do. We take care of all of those things with you. We walk beside you and help you and problem solve and make sure your final arrangements are made and you're at peace so that you can really experience this last transition.
And just not the dying person.
That's correct.
It's the family too.
Yes. So we follow the family with grief support and bereavement support for 13 months after they have passed.
This is a great.
It's amazing. Yeah.
Hospice. And you have bereavement counselors. You have classes. I've attended many of them here in Brookings.
Yes, we have our grief group here in Brookings twice a month. That's the first and third Tuesday at 3 p.m.
Where?
At our building on 585 5th Street.
Which is right behind Grocery Outlet and AutoZone there here in Brookings. So you have those bereavement people coming that are talking. They're mainly listening.
Yes.
And it's a big group.
Yes.
I go there and I get so much relief. It's like, finally, some other people kind of understand what I'm going through.
Yes, exactly. And I told them, I told you earlier, healing from grief is not, there really is no healing. It's really, how do you cope with this new pain, this new wound, and how do you get through the rest of your life living with it?
Yeah.
Right? Grief is incredibly isolating. And so that group, to be with other people that have experienced it, is incredibly, it just helps you continue to move through the process. I don't want to say healing because I don't know that you can heal. You always carry it with you.
Yeah, it's
right?
like a wound, but now you always have that scar.
Yes. And so the group really just can walk with you down that path.
So well. such an important thing. Regardless of religious, secular, whatever, wherever you're coming from, I highly suggest if you're going through a grieving situation, reach out to hospice.
Now, when you have a patient that does not die within the 6 months, how does the hospice service end?
So as long as a person is continuing to decline and we believe that death will be coming, then we stay with them, even if that takes a couple of years. We stay as long as they need us. If, on the other hand, they have stabilized or they have, because that happens frequently.
Yeah.
We give such amazing care that people frequently will stabilize. And so they come off. If they stabilize, then we graduate them. We discharge them back to their doctor and we let them know that we're here, when they need us.
Yeah, that's very awesome.
What insurance does Coastal Hospice honor?
Here in Oregon, we take everything. We take Medicare, Medicaid, private, Medicare Advantage, everything.
Okay.
And you say one can refer oneself, right?
Yes.
They can say, I think I need to be in hospice. And if a doctor refers, it would have to go through the hospice doctor to determine if that is. So would that go first through home health? You would, if a normal doctor refers them to home health and then with the consultation into a hospice? Is that how it works?
Not exactly. So if the doctor felt like we really need to go see them, the primary doctor would send a referral to us to hospice, and a nurse would come out and evaluate you and then deliver that information to the doctor, and they would consult and make a determination if you're appropriate.
Yeah. So the nurses are trained. Obviously, the hospice doctor is trained. Now, how do other people not so trained, how do they understand that a person, a loved one, is transitioning into death?
Yes. So that happens. I mean, people don't have cancer or something that's really obvious. And so you would look for signs of getting older. So that would be losing weight or stop eating, sleeping a lot, falling, increased trips to the emergency room. Those are really, telltale signs.
Those are the red flags, generally. Wow. And is there, you've already touched on this about the grieving families. We won't go back to that, the bereavement counselors that work with you. But what happens if a person doesn't have any insurance? What happens? Is there still
We still want you to come and talk to us, and we will figure it out. We have philanthropic money that we set aside so that we can make sure that we pay for your care.
Right on.
So the patient in hospice, can they still see their normal GP?
Yes, they can. They would see them for anything outside of that's related to their terminal diagnosis.
Blood pressure, diabetes.
Right. So if you're with us for cancer, we would take care of everything related to any kind of cancer or cancer symptom.
Yeah.
But if you got into a car accident, you would still go to the hospital. If you broke a bone, we would make a decision on whether or not we're going to fix that. So those kinds of things. But our doctor can take care of a lot of those, cardiac or medications or diabetes medications. We take care of those because a lot of people can't get to their doctors anymore.
Right.
What's the name of the doctor you said our doctor?
Dr. Pollock Patel.
Yeah, so
he's our doctor.
One of your colleagues, right?
I know of.
Oh, you know of him.
Yeah, I've seen his name.
Yeah. What other kind of doctors do you generally work with?
We will work with any of the doctors that send us anybody. Patients have the right to choose their attending physician. So Dr. Patel still has to determine that they are terminal in 6 months, but their doctor can be their primary doctor through their hospice care if the doctor agrees to it. Some doctors do not want to do it because they want the expert to handle it,
right.
A specialist.
Yeah.
So they don't always agree, but if they do, then we will work with them.
Yeah. Now, what doctors, or are there certain doctors you do not work with?
Not generally, no. I mean, if you're going to refer, then we'll if you're a primary, we'll work with you.
Are you aligned with the larger hospitals or medical organizations?
Nope. We're very independent.
Yeah.
Hey, who diagnoses terminal illness? Do you, doctor? You're the one that terminates, or who? So somebody, how does somebody?
Well, Dr. Patel. No, wait. I guess Dr. Patel says the 6 months, right? Well, it's usually. I mean, what I know, it's usually cancer related or advanced COPD type things. There are people who are just old. And there is no diagnosis, old age or natural causes. There is no diagnosis. So we have to say failure to thrive. Yeah. That is the diagnosis that we have to.
But they're showing symptoms like Jamie has shown, stopping eating, drinking.
Yeah, failure to
falling.
thrive. And that's where the failure to thrive comes in, which is
Failure to thrive.
strange that we cannot say old age.
But aren't we, Jamie, we're all terminal, right?
Yeah, sure. Which is the reason why we should all be having conversations about what we want at end of life, regardless of our age. I mean, really, as soon as you become an adult is which 18, you should be having conversations about what that looks like when you die. What do you want?
Yeah, so when we do Medicare wellness visits, we always ask, do you know what advanced directive is? What do you want to have done? Is especially if there's something, not necessarily hospice, but if you cannot make the decision, what do you not want done? If you want everything done, you don't really necessarily need that is the default. But if there's something that you do not want done, it needs to be in writing. Because if you're in a car accident, you're knocked out, you're unconscious, and if you go to the ED, they can't read your mind. If there is something that you don't want to be intubated, well, it better be in writing somewhere because they will do everything they can to keep you alive. That is the prime directive. So if there's something that you do not want, it needs to be in writing and it needs to be at your hospital. We usually ask for it, although you will not see me when you are unconscious because then you go to the hospital. But it still needs to be in writing, and then we send it off to the hospital. Very important.
Yes, but it really needs to start so young because would you agree that when you have these conversations, they're very uncomfortable? People don't want to start thinking about that. They've never thought about it, and they don't want to give the impression that they don't want to fight. You know, if we have these conversations, that means that we're giving up, and that is not the case at all. It is really, it is going to be a fact. At some point, this is going to happen.
Right.
So we really need to plan.
And a lot of times, actually, people say, well, I have kids and they want me to do certain things. And I say, this is not about your kids. What do you want?
Right, that's palliative, operative mode, right? It's what the patient is better.
But we get that in hospice, actually, where a patient is very appropriate, but their children do not agree, and so they don't come on.
Oh, my goodness gracious. Okay, now, if we shut our ears to death, we shut our ears and eyes when it comes to sex and death. I mean, it's like, hey, shh, quiet, the kids are going to overhear us. And people cover up. You've been around people that put their fingers in there and said, don't talk about death. I don't want to know. What are you talking about? They get upset. But it's something we are all facing. We're all walking our way towards death, right? So be more prepared. Is there a plan? Is there any time too early not to reach out to hospice? If you're suspecting someone is entering that autumn of their life.
Yes. I mean, we're happy to, look at your medical records. You should be having difficulty with activities of daily living would be a good time to reach out to us if that's starting to happen. If they're pretty independent, and then that's not really a good time if they don't have any kind of disease process.
Well, if you're thinking about it, what did you say, 1977? That is almost as old as me. No.
We've come a long way,
So
baby.
this is not a very long history. No. So a lot of people actually do not, especially the older generation, doesn't know about this.
Wait a minute. Hospice? Well, again, I'm used to it. Since Mom died in 96, when I got my first dose of it, or actually earlier than that with a couple of friends. Yeah, it's been around. It's been a power thing. But again, do you find people still not understand what hospice is all about?
Yes. I mean, frequently we go out and they don't want it. It's not what they thought. As much as we explain it, they think we're going to euthanize them. They don't understand. Yes. And it's because they don't have experience, especially, these 90-year-olds. That's not how their parents
Right.
passed.
Exactly. Yeah.
So you just said a word, euthanasia. What's your opinion on Oregon's legal euthanasia?
My opinion is that every person has the right to self-determination. And so they really should be, if that's something that they want, if they want to look into and they decide between them and their provider, their doctor, that they're appropriate for it, then we will assist them and help them, walk beside them, and they are not alone through that. But we don't do that process because they have to work with an outside provider for that.
Yeah.
Right. What's the black pill, Doc? Is there such a thing? Black pill? Are you're
I don't do.
You're in
I'm not in
California.
Oregon.
You're
It's
not in
actually
Oregon.
a concoction,
Is it?
and it comes in a powder that gets reconstituted into a liquid.
Wow.
Yeah.
You have connections to.
I have connections. Yeah, there's.
Yeah, you have.
I've had some friends that have passed by choice.
What is the hardest part of your job?
Well, like I said before we were in Del Norte, telling any resident of Del Norte County when they were calling here to Oregon and wanting services, needing services badly, and we had to tell them, no, we could not come across the imaginary state line to this wall and help them. That was heartbreaking. It really was. That was just because we had the skills, we had the ability, we had the resources, and we just could not do it. And
But
that was
regulation-
really hard.
It's amazing. This border. It's unbelievable how
Don't bring your fruits or vegetables or hospice over here.
yeah, bug shed. The bugs kind of did right there. Apparently, what's it like making new friends with people and families that are dying?
Wow.
It's not as hard as you might think. We learn in the medical profession pretty early about boundaries, and I treat everybody in every aspect of my life the way that I want to be treated.
Yeah.
And so I really want, that's how I treat them. But I make sure that I maintain that boundary because I really don't think I would be of any service or good for them
Right.
if I am
If you're involved emotionally
too
right?
much and I'm crying or, I'm there to support them.
Right.
They are not there to support me.
Correct.
Yeah.
Now tell us, what do you like most of your job?
Yeah. What's your
Probably that
favorite
part,
of
right?
your job? Yeah.
Oh my gosh, helping people.
Yeah.
We get so many wonderful letters and thank yous from people we've served, and it is amazing the people's lives that we've impacted. And that's the thing that I love about going to people's homes. I really, truly feel like being invited into somebody's home is an honor that people do not realize how hard it is for a lot of people to invite a stranger, an expert into your home, and it's an amazing experience to be there and to help them and to make a difference. It's something that they will carry forward with them.
Right on. And you got a great personality, Jamie, and you look nice. Again, you got the whole package. Good for you. Sadly, though, as I learned in our earlier conversation, so many people die alone. They don't have family. They don't have anybody that cares about them. They're just dying in the home. So what happens there? Your hospice is you're right there, the last moments from the right at the end.
We do what we can. We really believe that people can make their own decisions, and we are in a geographical area that people move here for a reason. They want to maybe remove themselves from their family situation, or they want to live a certain lifestyle off-grid, or, more rural. And so we honor that. We're okay with that. We want them to live and die the way that they want to.
You also offer lots of medical stuff, right? I mean, equipment, walkers, breathers, things like that. Coastal does that, right?
Yes, we have a durable medical equipment store, Coastal Medical Supplies. It's attached to our building on 585 5th Street.
Okay.
And we have hospital beds, wheelchairs, walkers, bedside commodes, shower chairs, over-the-counter medication, nebulizers, diabetic supplies, incontinence supplies. I mean, it's a lot. And we take insurance, so we take Medicaid and Medicare. And and we have people there in the store that are going to help you.
Yeah.
So
I want to say one more thing about dying people. Some people say, I can't handle it. I don't want to see the patient dying or the friend or the father. And what I'm tempted to say is it's not about you.
Yes.
It's about the person who is dying and you're supporting their transition.
Mm-hmm.
Right. Yeah.
I think that's something.
She stated those same words earlier. I agree. Right. I mean,
it's their death.
It's their death, not ours. Jamie, where do you see yourself in 5-10 years from now?
I'm here. I'm here.
All chips in?
I love this area. I love what I do. I love this company. I love the people that I work with and the people we serve. I'm very community focused, and so, which is the reason why we opened our medical supply store, because it was a huge lack of resources here. And this
Is that like Lynn Care for just any DMEs, or is that for
almost? Yeah, we don't do oxygen.
Yeah,
But for the general public.
Yeah.
But we do pretty much anything else, and we can get quite a bit. So we take provider orders, and we deliver. Yeah. And we.
Oh, yes, right. You deliver. So listen, folks, you have an advocate that you can use, and hopefully do. Take advantage of Hospice. It's a great organization. It's been there for both GiGi and I. Big time. Big time. Yes. Good for you. Hats off. Deep bows before you. How do people contact you, Jamie?
Our number is 541-469-0405.
Okay, that was 541-469-0405, okay?
And our website is coastalhhh.org.
coastalhhh.org. All right, it's like KCIW.org. It's so simple. It's good. We all know that. How about social media, Facebook, anything like that?
We're on Facebook, Coastal HHH, and you can email us too, info@coastalhhh.org.
So for volunteering, for getting information.
Yes.
Now you also have mixers or some social something or other where people can come and ask questions. Do you have that, or is it more you go to your building and ask questions?
Yeah, we are more than happy to see you if you come into the building or call.
Yeah.
And the hospice in Brookings is right behind Grocery Outlet and
Just
AutoZone.
Yep, right up the hill.
Yeah. And then in Brookings, you got a new, smaller location. But
yes, in Crescent City, it's on the corner of 8th and H.
8th and H. So there you go, folks. Wow. What a great guest you've been. Thank you for coming.
So interesting, so important. Oh,
and it's something we're all going to deal with, right? I mean, we're all going to have our demise, whether we like it or not. So, Jamie, thank you. Hats off to you for doing what you're doing.
Much. Very important.
We love to see a woman in a position such as yours. You're a CEO. You're well qualified, and we really, really enjoyed it. And it's an important message what we've discussed today.
Thank you.
Go ladies
for
first.
having me.
Yeah, go ladies first. Yahoo! Okay, Dave and Janice and dozens of other you that only listen to the show for the jokes and the quotes at the end. No, they're for the quotes, not for the jokes. How is exercise? Does exercise have anything to do with your belly issues?
What do you mean?
Well, exercise. I thought you said extra fries.
That does.
Yeah. Okay, what's some quotes?
Okay, some quotes. We're going back to the digestion. Like a little upbeat, right?
Yeah, we got to bring it upbeat.
Yeah.
There you go.
Life is uncertain. Eat your dessert first.
Right on. Life is uncertain. Eat your desserts. Hey, by the way,
Homer.
did you know that that stressed, spelled backwards, is desserts? Stressed, spelled backwards. Yeah, it's desserts, and you don't think that's a coincidence, do you?
Of course not.
Of course not. That's stressed. What do we have?
Like
our yogurt when we get back. Yogurt, and peanut butter, and chocolate chips. Oh, yeah.
Give away our
What else you got? What's a good quote?
dessert things. One cannot think well, sleep well, or love well if they have not dined well.
So true. Every night when I get up
Virginia
around Virginia Woolf,
Yeah.
that? So you don't do anything well unless you've dined well. That's why I know that
eating
every night,
yogurt.
at 1 o'clock in the morning when I go down to the refrigerator, it's supposed to be that way. Midnight snacks are supposed to be that way because why else would they put a light inside a refrigerator? Right? To light up your way to Nirvana.
Totally makes sense.
Mm-hmm.
You're really on it now. I even laugh at your jokes. They're funny this time.
What else we got?
Eating food is the most primitive of all comforts.
That's true.
Yeah.
Eating
Sheila
food
Graham.
is the most primitive of all comforts.
What is that Maslow
The Maslow.
the hierarchy? Yeah.
Needs.
Yeah, that's it.
Hey, I'm on a 30-day diet. So far, I've lost 15 pounds. Or no. I just fluid. Sorry about that, Janice. Hey, you know what? I'm on a 30-day diet. So far, I've lost 15 days. You're lucky you'd heard that one earlier. All right. What is another quote?
Life is too short to eat boring food.
I like that one because it is true, right? We should dine. We should eat well. We should plate our plates. We should mastication.
Yeah, mastication.
Mastication, chewing.
Yep.
I got some gum. Tom is going crazy when don't chew gum on the air.
Okay.
I don't have a beer gut, Doc.
You don't?
No, I just have a protective covering for my rock hard abs. Yeah, it's encased like my cooler. Yeah, full of beer. Hey, the Super Bowl's coming up. That's right. 49ers. That's right. This is the last show before the 49ers. I think are going to take the Kansas City Chiefs, although I have a home in Missouri. My parents were from Missouri. I'm a San Franciscan. Hey,
I kind of have to like 49ers because Jacques likes 40s, but I kind of like Mahomes. So
well, who doesn't like Mahomes? He's Mahomes guy.
he's Mahomes.
Okay.
Food is the great equalizer. It brings people together from all walks of life.
That's so true, right? We can all gather in peace around food. It brings us all together, no matter what our walk of life is. Did you know that waffles are just pancakes with abs? I'm looking over. Okay, I got a little laugh from Tom. Okay, Ray left the building just now. He's going to go to Chetco early. He's starting right now.
They're better than your Santa jokes, for sure.
Okay, what else you got?
Oh, this is a really good quote.
Okay.
Let food be a colorful canvas so you can be an artist.
Oh, I know who wrote that one.
Who?
Jacques.
Jacques. Okay.
I wrote it. It's true. Let food be a colorful canvas so you can be an artist. I'm working on some artwork, right? At that house.
You
Some
are.
Beautiful paintings and doing all sorts of stuff. And it's same thing with plating food. Plating food.
Oh, you are a master in plating food. He is so good. He is.
Chefing is one.
Yeah.
Preparing the food, but plating it.
Yeah.
And service. The three components.
presentation.
Yeah, the presentation is
I take pictures because it's just really awesome.
He always says, we'll see when I
And
pass
he
it.
still plates them up like that.
I still plate him up. Like, hey, by the way, I'm not fat. I'm just easy to see. All right. And last, folks, cupcakes or muffins that believed in miracles. Yeah, cute little muffin things. Okay.
Wait, you have one other one.
What?
This is
Where?
a fun one.
You got one? Okay.
Yeah. What do you call a fake noodle?
Oh, I already said that one. Impasta.
You did?
Yes. Oh, taste. Shows you how much cheese. Okay, get into it. Doc, we have some new music going on.
Okay. Yeah, okay. We reached this magical ending time for this week's live radio variety show. You have been listening to Doc and Jacques, ladies first, on KCIW LP 100.7 FM in beautiful Brookings, Oregon. We hope you have enjoyed this show. Jacques, Wolf, and I certainly have. Right?
I think I'm dropping the wolf because it sounds like there's three of us in here. Yes, that's right, Doctor. Again, Jamie Daugherty, thank you for coming into our studio. You're welcome back anytime. We'll get updates what's going on. A special thanks to Tom Bozak for his engineering wizardry, and Ray in there, and everybody. Ray's party tomorrow night at Brewery. Find out more, go to Jacques Kepner on Facebook. Goodbye.
Goodbye. Thank you.